Welcome back guys. Now in this video let's discuss about obstructive lung diseases. Let me write here obstructive lung diseases. Okay, simply we are going to call it as OLDs. Okay, obstructive lung diseases. Now where exactly is the obstruction, sir? Obstruction for what? See, if we talk about this obstructive lung diseases, you can understand what is this obstruction. See, there is obstruction in the airway. Okay, obstruction is there in the airway. Okay, there is obstruction in the airway. So there is obstruction for the flow of air. There is obstruction for the flow of air, sir. Now I will tell you what are the different types of obstructive lung diseases. But here the first thing which you need to understand is, sir, in obstructive lung diseases, whatever I am going to discuss, the main problem is with the expiration. Okay, main problem. It's not with the inspiration, the main problem is with the expiration. Okay, having said that, now directly jump into the classification of obstructive lung diseases. What are the obstructive lung diseases? Do you know? How many types of obstructive lung diseases do you know, guys? Say, there are COPDs. Okay, COPD means chronic obstructive pulmonary disease, chronic, okay, for long duration, continuously, chronic obstructive pulmonary diseases. Okay, next one, most of the student knows this is asthma, and the last one is bronchiectasis. Okay, bronchiectasis. So COPD, asthma and bronchiectasis. Now in this video we have to discuss about these obstructive lung diseases. See here, the chronic obstructive pulmonary diseases, they include, see what are coming under this chronic obstructive pulmonary diseases, sir? If you ask me, COPDs, they include emphysema and chronic bronchitis. Okay, now let's begin with the asthma. Okay, let's begin our topic with asthma. So what exactly is this asthma? What is the pathophysiology under this asthma, sir? See, there are certain people, okay, who will take the dust particles and pollen grains as antigens. Okay, normally imagine if I go to some garden, there I am going to inhale some pollen grain. What happens? These pollen grains are going to come and lodge in my alveolus. There my alveolar macrophages, the dust cells, the alveolar macrophages, they will go and they will take up this pollen, and the pollen is going to be digested away there. Okay, so nothing will happen in a normal person, but there are certain individuals where they will take this pollen, they will consider this pollen as antigens. Okay, for example, let me take this story. Imagine this is the person. Okay, here is a person. Now this person went to a garden. Now in the garden, this person is inhaling pollen. Okay, now this pollen is recognized, this pollen is considered as an antigen. So the macrophages, the alveolar macrophages, they will go and they will take this pollen and they are going to destroy the pollen, but these macrophages will present these particles, pollen particles, to the lymphocytes. Normally this won't happen in you and me, okay, but in certain individuals what happens is the pollen, the digested pollen particles, these antigenic particles, now they are presented to the lymphocytes. Now what lymphocytes will do? B lymphocytes, what they will do? B lymphocytes produces the antibodies. So in this particular person body, for the first time, in this person's body, for the first time, antibodies are produced. Okay, inhaled pollen, immune activation, so immune system got activated. Now this immune system, it is producing antibodies. Okay, produces the antibodies. Okay, here see, dekho. Now in this patient's body, the antibodies are there. Now what happened to these antibodies? So these antibodies, which are IgE type of antibodies, now these antibodies, they will come and sit on the cells. There are these cells, look here. Okay, there are these cells. These antibodies coming and sitting on the cells. Okay. So what are these antibodies? These are the Ig antibodies. And what are these cells? The cell which I am talking here, it is called as a mast cell. Okay, mast cell. Now what are the important points about the mast cell? Sir, inside these mast cells, if you look, okay, inside these mast cells, there are these granules present. See, there are these like vesicles, or I should say granules, with lot of substances which are already preformed. There are these granules present. Now do you know what are these granules and what these granules consist of? Okay, the contents are important. These granules, they contain histamine. Okay, they will contain this histamine. Okay, now where these mast cells are present, sir? See, now what we know, the mast cells are loaded. The mast cells are loaded with these antibodies, and mast cells are waiting for what? These antibodies are produced against what? The pollen. See, for the second time, okay, for the second time, the same person, now already this person is sensitized. Now if this person takes this pollen again for the second time, what happens? Sir, this pollen, this antigen is going to trigger. The antigen is going to trigger these antibodies. Antigen, actually what exactly happens is the antigen causes the cross-linking of these antibodies. Antigen that causes the cross-linking of these Ig antibodies, so that the mast cells are activated. Now second time when the person takes the pollen, the mast cells are activated, releases the histamine. Now what this histamine is going to do? Now the histamine is going to cause bronchoconstriction. Okay, so this histamine is going to cause a bronchoconstriction. Is this bronchoconstriction is going to be reversible or irreversible? This is reversible, of course reversible. So what is the main problem in asthma? Now tell me. Sir, in asthma there is reversible bronchoconstriction. There is reversible bronchoconstriction that is happening. Okay, there is reversible bronchoconstriction. So here what exactly is the problem? The problem is not with the pollen. The person's immune system is doing some overaction. Unnecessarily, the substance which does not have any antigenic nature, now such a substance is recognized as an antigen. Okay, and the body's immune system is producing the antibodies. So problem is with the immune system. So that's why we are considering it as hypersensitive reaction. So this asthma, it is recognized as type 1 hypersensitive reaction. Okay, so you can simply say what are type 1 hypersensitivity reactions? Type 1 hypersensitivity reactions are allergies. Okay, type 1 hypersensitivity reactions, they are allergies. So there are allergies, allergic conditions, atopy, anaphylaxis, all these are examples of type 1 hypersensitivity reaction. Now what else you should know? What else you should know is, sir, which people are going to develop, okay, which people are going to develop these asthmatic conditions? Not everyone. There are certain predisposed individuals. So who are these individuals, or who are the special people? See, interleukin 13 gene polymorphism, those people who have interleukin 13 gene polymorphism. Adam 33 gene polymorphism. See, they are same. Okay, in those people who are having asthma, it is observed that these people are having these genetic things. Okay, the interleukin 13 polymorphism and Adam 33 gene polymorphism, these are observed in these patients. Okay, so what exactly is asthma? Asthma is a chronic, it's a chronic relapsing inflammatory condition, chronic relapsing inflammatory condition. Okay, it happens again and again. Say again this person third time he goes into the same area where there is a dust or pollen, again this dust is considered, or the pollen is considered as an antigen, again immune activation, again bronchoconstriction, again normal. So it is chronic condition, it happens and again, relapsing condition again and again. Okay, chronic means for longer time. It's going to be there, not for just 1 week or 2 weeks, it's going to be there for longer duration, years together. Once a patient is having asthma, he will be having that asthma for years together, means recurrent attacks will come. Okay, so these are some important points which I want you to know. Now in asthma, apart from this polymorphisms, genetic things, what else? See, the smooth muscle, whatever is there around the bronchus, imagine this is the bronchus. Bronchus is surrounded by the smooth muscle, right? Now even this smooth muscle will show hyperreactivity. Okay, first thing in asthma, what you will see? Okay, in asthma what you will see is hyperreactive bronchial smooth muscles. Second thing which can be seen is hypersecretion of mucus. Okay, so these patients who are having asthma, they will be having hyperreactive smooth muscles around the bronchus. So they are, even for a little irritation, they are going to be reactive. Okay, they are going to be too much reactive, causes bronchoconstriction. The smooth muscle contraction around the bronchus is going to cause constriction, bronchoconstriction. And whatever the glands which were there, they will also be producing more and more mucus. As there is more and more mucus secretion, what happened to the lumen? Patency of the lumen is going to decrease. Okay, so both these two things, they are going to contribute. Okay, these two things, they are going to contribute to the reversible. Okay, these things are going to contribute reversible bronchoconstriction. Okay, so they increase the airway resistance and bronchoconstrictions. Now what else are the important points which you need to know for your exams? Especially this is very important. Now imagine that I am a patient who is having asthma. Now what I will be having, definitely it's very hard for me to breathe. Okay, because of airway hyperreactivity, bronchoconstriction is there, and even more glands are producing the secretions. So there is a decrease in the patency of the lumen of the bronchioles. Now whenever I am having cough, okay, I have taken the pollen, but that's causing the irritation, I am going to have the cough, right? Immediately I am going to have the cough. My cough reflex is going to get activated, because to try to remove the toxic thing from out of the body. So immediately cough reflex will also start. So when the person is coughing, the sputum is going to come out. So what you will see in the sputum? Okay, examination. Okay, under microscopy what you can see. See, these patients who are having this asthma, these patients are going to have, see, in the sputum, let me write here, sputum. In the sputum, what do you see? You can see 3 C's in the sputum, 3 C's. What are these 3 C's, sir? These 3 C's are called as, first, Charcot-Leyden crystals. Charcot-Leyden crystals. Second one is Crayola bodies. And third one is Crushman spirals. Okay, so Charcot-Leyden crystals, Crayola bodies and Crushman spirals. Images. Sir, what are these Charcot-Leyden crystals? Let me show you here. Dekho guys, here. These are the Charcot-Leyden crystals, which are seen in the sputum. They are seen in the sputum under microscopy. Sir, what exactly are these Charcot-Leyden crystals? Okay. So these Charcot-Leyden crystals are made up of substance called as galactan. Okay, galactan 10. So what are these Crayola bodies? These blue color things what I am showing you, see, these are the Crayola bodies. These are nothing but the epithelial cells, the cluster of epithelial cells that are getting denuded and coming out. Okay, so these are the epithelial cells. Crayola bodies are epithelial cells. And what are these Crushman spirals? Sir, Crushman spirals, they are made up of what? They are made up of mucus or mucin. Crushman spirals, images, dekho. So that's why they are called spirals. See these spiral shaped things. Okay, these are the Krushman spirals. Okay, done. So after this, what else you need to know for your exam? See, after collecting the sputum, the sputum need to be fixated. Okay, so what is the fixative that is used? Okay, what is the fixative that is used for the sputum? See, this is the fixative. Okay, what is this? Sacchomano fluid or the Sacchomano fixative. Okay, so sputum fixative is fixative. It is called as Sacchomano fixative. Okay, so this is also the question which was asked in the previous exams. Now after this, what else regarding the asthma? Now if you look at the airway of a person who is normal and a person who is having asthma, there is a difference, sir. There is a very big difference that I will show you. Okay, look here. Now see, here I am talking about the healthy person. Here I am talking about the person who is having asthma. Okay, healthy person, asthmatic person. Now, do you think both the airways are normal? Both the airways are looking the same way? Definitely not. Definitely they are not the same. So, what is the difference, sir? See, there is some change that is happening, right? In the airway, there is some change that is happening. What can you see? Sir, here they go the lumen. The lumen is very big. Here the lumen got decreased. Okay. So, here more glands are there. Here more smooth muscles are there. More like fibers are there. Okay. So, this change that I am going to discuss here, it is called as airway remodeling. So, what is seen in asthma? In asthma, there is airway remodeling. Okay, airway remodeling. So, what exactly is this airway remodeling? Okay, remodeling. What exactly is this airway remodeling? See, here what you can appreciate is there is hypertrophy and hyperplasia of the mucus glands. Okay, when compared to this side, here more mucus glands are there. Hypertrophy and hyperplasia. Okay, hypertrophy and hyperplasia of mucus glands. What else? There is increased deposition of subepithelial collagen. So, where exactly is this? See, look here. Now, these are the collagen fibers, right? These are the collagen fibers. Okay, these blue color things are the collagen fibers. Now, here see, there is so much amount of collagen. There is so much amount of collagen is there. Okay, increase. Okay, increase collagen. Because of more collagen, the airway become also stiffened. Okay, so that's the one change which you can appreciate. Next, hyperplasia of what? Hyperplasia of airway smooth muscles. The amount of smooth muscles in the airway also got hyperplasia. Look here on this side, yes, smooth muscles are there, sir. Little amount of smooth muscles are there. But when compared to the asthmatic person, see now compare it with the asthmatic person. See in the asthmatic person, see there is so much amount of smooth muscle, so much. So that's why we go hyperplasia of airway smooth muscles. Okay, so that's the one change which I want you to know. And last one, increase vascularity. Okay, increase in the vascularity also. The amount of blood vessels that are going to be present, okay, are also going to be increased. So this is histology. You can very clearly see this is normal, this is asthmatic. Look at the asthmatic person. So there is hyperplasia of the glands, increased vascularity, hyperplasia of the smooth muscles, increased deposition of the collagen. All these things are going to be appreciated. Now after this, for your exam, what else you should know before going to the exam? The recent question which was asked is, sir, types of asthma. Sir, how many types of asthma are there? Actually, there are two types of asthma. What are they? The first type is called as atopic. asthma. The second type is called as non-atopic. Okay, atopic, non-atopic. See, atopic means it's simply allergy kind of thing, atopic. Now, this atopic asthma, it is seen in children. So, non-atopic asthma is going to be seen in adults. Now, in atopic asthma, the IgE levels, the exact thing, whatever we have discussed, the pathophysiology, hypersensitivity reaction, high levels of IgE antibodies, okay. So, IgE antibody levels are elevated, okay. In the blood, IgE levels are elevated. Here, non-atopic asthma, IgE levels are normal. IgE levels are going to be normal. Sir, in atopic asthma, okay, in atopic asthma, there is positive family history, okay, positive family history. There is no family history in non-atopic asthma, no family history. Now, examples, that this is a question which was asked in the recent exam. The examples are allergic bronchial asthma, the one exactly we have discussed, allergy because of the inhalation of the pollen, allergic bronchial asthma, occupational asthma, the person is in some occupation, there he is getting getting this some dust particle or something which his body is recognizing as an antigen. Again, allergy to that particular substance is causing the bronchoconstriction, okay. So, that is occupation asthma. And one more thing which is called as allergic bronchopulmonary, allergic bronchopulmonary aspergillosis. So, allergic bronchopulmonary aspergillosis is also coming under atopic asthma. Now, what are the examples of non-atopic asthma? Okay, non-atopic asthma examples, what are they? Non-atopic asthma examples are exercise induced, okay, exercise induced or drug induced, or cold, okay, cold. See, cold will also, cold is also considered as a non-atopic variety of the asthma, okay. So, cold or because of some viral infection. So, all these are examples of non-atopic asthma. This is the question which was asked in the exam. So, a person who is doing exercise, whenever he tries to do the exercise, then he is going to get this asthmatic attack, okay. There is no allergen that is entering into the body, okay. So, it is an example of non-allergic type of asthma, okay, non-atopic asthma. So, with this, important points about the asthma are completed. Now, in the next video, we will be discussing about bronchitis, bronchiectasis, as well as emphysema, okay. Hope the video is helpful. Thank you.